Senhoras e senhores, bem-vindos à comunidade MTC e hoje estamos acompanhados pelo Dr Andre Tsai, que é o presidente da Colégio Médico Brasileiro de Acupuntura. Bom dia, Dr Tsai.
Bom dia, tudo bem, Dr. Dopi?
Tudo bem, tudo bem. Obrigado por participar e contribuir à nossa comunidade MTC. Eu acho que, por causa do público internacional, continuaremos esta entrevista em inglês. Se estiver tudo bem para você?
Eu que agradeço o convite. É uma honra estar aqui para conversar um pouquinho. E é claro que eu gostaria de que a entrevista fosse totalmente em português, porque para mim é muito melhor. Mas, okay, no problem. We can continue in English.
Okay, muito bem, muito bem. So like I said, Dr. Andre Tsai is the president of the Brazilian Medical College of Acupuncture, and he's also the vice president of the Pain Management Committee of the Brazilian Society of Orthopedics and Traumatology. So first of all, thank you that you're willing to share the progress TCM has been making in Brazil. And I think, you should be proud of these accomplishments, as in my opinion, outside of Asia, Brazil has a very progressive role when it comes to TCM compared to a lot of Western societies. And I was hoping you could tell us, we'll start by a little bit of the history of TCM in Brazil. How did it come about? Why is it so progressive in Brazil?
Well, Dr. Dopi, I'm very glad to be here, and it's my honor, my pleasure. Thank you for this opportunity to share with all your members and about our history, about TCM in Brazil. So actually, the traditional Chinese medicines was brought by Japanese and Chinese immigrants. This maybe 200 years ago. In that time, they practiced acupuncture, Chinese herbs, moxibustion, cuppings. But 200 years ago, this kind of treatment is not was considered by our Western medicine. So for a long time, acupuncture and TCM was considered by Western physicians like alternative treatment, or like something like placebo and non-effective treatments. So only 50 years from now, we have more and more research about, especially about acupuncture and some Chinese herbs that can prove how acupuncture works and how effective it is, and also to the Chinese herbs and tuina and other treatment from TCM. So we have this progress, and now in Brazil, all the community, all our society, they accept very well all the TCM treatments. So this is not very easy, but I believe that the research were very important to our society to see and to take some information about TCM. Because if you talk about the basic theories by TCM, like yin yang, 5 elements, our mind is not open to this. So we have to change some language, and we have to say about neurotransmitters and some terms in Western medicine. So I think now we have a very big agreement with both medicine. So what we do now is the integrative medicine using TCM and Western medicine to offer to our patients the better condition of treatment for their diseases.
Right. So you would say the traditional Chinese medicine is now very much integrated in the public health system of Brazil.
Yes, you're right. We have in our public health system, we call this SUS, Sistema Único de Saúde. This public health system is from the government and is totally free for the population. And we have some programs to offer acupuncture, toina, moxibustion, and cupping. And now, maybe 4 or 5 years from now, you also have Chinese herbs. The Chinese herbs is the last part of TCM that our government is regulating this issue.
Yeah, so at this moment you are still regulating the Chinese herbal medicine, and
yes.
you expect it to be in about 4 or 5 years that it will be done.
Yeah, I think so. Yeah. So Brazilian people can reach and can take these treatments from TCM. But I have some worries about that, because if you don't have this kind of situation very well regulated, maybe some side effects that we know can happen. And so maybe some kind of negative aspect. So because, you know, sometimes people that is not from the health conditions, like doctor, nurses, they also want to practice TCM, and I think this is very dangerous. We have to regulate all these conditions.
Yeah, that's why you need strict regulation. And I think also in education, it's important.
Perfect.
Yeah. And by the way, the education, because the herbs, the regulation for herbs is not in effect yet, but are there already Chinese herbal courses that you can do in Brazil?
Yes, we can. We have some models and some kind of course. The best of them is from the residence program. So after your graduation, you apply to the residency program that you have 2,880 hours per year, at least 2 years.
Yeah.
And you can apply for the additional year, the optional year, the resident free.
Is that residency only for, is that also for acupuncture?
Yes, acupuncture.
Oh, that's for acupuncture. So if you want to do herbal medicine, is it a separate residency, or is it in that same year residency?
Because about this issue, we don't have the regulation. So now it's only for acupuncture. Of course, when you take some classes from acupuncture, you also will learn about Chinese herbs and TCM. But our resident program is based on the acupuncture.
Yeah, that's the way it goes usually in most countries. That also in the Netherlands, but in the United States also, that in some states the regulation for acupuncture was done first and then later for herbal medicine.
Yes, this situation is the same here in Brazil. I think we will pass for this regulation, and then you can teach the Chinese herbs more properly.
By the way, since when has the acupuncture been regulated as integrated in the system in Brazil? Since what year?
Since these are very, very complicated because, as you know, maybe in all the world you have physicians and no physicians. I think this is a very, very common fight. But so I can't, because I'm a doctor, so I will tell about our Western Medicine Federal Council. So they recognized acupuncture since 1995. 27 years we have the acupuncture recognized by our Medical Federal Council. Okay. So it's very, very new, very recent.
And then because you made a distinction between physicians and non-physicians, are there also non-physicians that are able to practice acupuncture in Brazil?
This is a big issue, big problem, because we have a law, a project of law, and we are fighting in the senator to regulate who can and who cannot practice acupuncture. Maybe the most important, as you said, is about concern in the education, about how you receive all the knowledge of TCM. Because in China, in Taiwan, acupuncturists and who works with the Chinese herbs, they also are doctors in their countries. As you know, 医生 or 医师, 中医师, 西医师. So even in China, you have this title of physician or doctor. So what we have here in Brazil, everyone who are interested in TCM, he can go to any kind of school and took some classes, and after 1 month, oh, I am acupuncturist, oh, I can prescribe Chinese herbs. So this is very dangerous, and we have to pay attention with that. So when we are talking about this problem, we are talking about how professional from this kind of TCM treatment could be formed or graduate by which kind of system of education. This is the first point. And the second point about the diagnosis. We are discussing this issue because we believe that we have two great medical systems in the world, the Western medical system and the TCM system. And of course, we have others, but each one has your own diagnosis methods to make your diagnosis. In my opinion, this is a point of view about the human being. TCM has another point of view, but we have to integrate them. Right. So we have to have the both diagnosis to treat our patient, because you see, I see, and we can match and we can do something better. Can you understand what I mean?
Yes, definitely. That's also basically the model that is used in China, because they use both systems.
Perfect.
Yeah.
But this is more secure for our patients. This is better to everyone, because if you miss, or if you make some wrong diagnosis, you will offer to your patient the wrong treatment, and you can make worse their conditions. So who defends that TCM can be practiced by everyone? They say, oh, we can make the TCM diagnosis. But I argue them, because this is maybe not enough. You have to complement with the Western medical diagnosis. So this is very important. The Chinese diagnosis is not better than Western diagnosis, and vice versa. Okay, we have to match, we have to combine, and then we can offer better treatment, and we can decrease all the chance of side effects.
Yeah. I think in your view, it would also be great if there were, for example, additional courses of traditional Chinese medicine in the regular medical schools, right?
Yes, yeah, you're right. So more information, more knowledge for both systems. This is better for everybody.
Yeah.
Right. So maybe we can focus on another kind of fight. Not B is against A, or A is against B, but A and B have to sit on the same table and to discuss how we can join our efforts and our energy and our goals to make the better or the best law or regulation to our country.
I think the way for, and not only in Brazil, but for all over the world, in order to get a truly integrated medicine, is like we have in the TCM education system, because of course you have to comply with Western anatomy, physiology, stuff like that. Also in the regular the mainstream medical system introduce obligatory courses for TCM, so that Western medical trained doctors also know, even if it's a little bit from the obligatory courses, what TCM is about. And then of course, if you want to specialize, you could go on specializing in TCM.
Perfect. Your speech is perfect. I believe that. Yeah, right. But we have to open our mind to both sides to see that we can make this together, and not persist the position that no, only this, only that, or we can separate. No, it's not. We have to discuss better, and maybe I believe that this will progress, and we can reach a very good regulation about who can practice and who cannot practice. Yeah.
By the way, I recently saw on your Instagram that you were on CNN, right, for Brazil? CNN.
CNN Brazil, yes.
About Rodrigo Caio from Flamengo.
You like football, you like soccer, right?
I'm always, whenever Brazil is playing, I'm always watching the national team. So for every World Cup, I'm for Brazil.
Yes. Oh, really?
Yeah.
So
yeah.
you contact me next time, and we can meet presently.
Okay.
So I like very lot soccer, but I do not play well. But I also like very much. About the interview, unfortunately, we have a soccer player,
Yeah.
Rodrigo Caio, and he made a surgery, arthroscopy in his knee, but he took some complication, infection, and this is very bad. It's very complicated because infection is very aggressive to our cartilage and to our joint. So we don't know what will happen with him, but I hope that all the treatment can help him, and he can return to play soccer. So, but it's a very hard, very difficult situation.
Okay.
Infection in orthopedics is like a cancer. It's
Yeah,
very aggressive.
Okay. Yeah, so about the Medical College of Acupuncture.
First, I would like to make clear that this name college in Brazil is not equal to the high school or college in states. The name college in this case is like is similar to association, society. Okay, this is not actually a college.
No. It's like Colégio Médico Brasileiro.
Yeah, exactly.
Okay.
So how you can apply? This is an association that all the physicians from Brazil can apply, even those that don't have any kind of knowledge about TCM, you can apply. But usually, this association, this college is to help our members to make some exchange, international exchange, to promote Congress, to promote some educational updates, and so this is the aim goal of this association. So we take all the medical physicians that knows acupuncture and who is still under taking this graduation, and we put them inside our association to offer them this kind of updatings.
So it's also for regulation purposes.
Also, but it's not only the regulation. We also offer some benefits to our members. Of course, this is not you cannot obligation them, make some obligation to become our members. This is very voluntary decision. Okay, so to apply, you have to pay a fee, an annual fee, once per year, and renew it every year.
Do you also and then you also offer courses, for instance, or training?
Yes. Okay. We have a specialization course, 2 years long, in seven different cities in the Brazil, and we have 40 students already, Western doctors that applied our course. So now we have this course to form more acupuncturists here in Brazil. And we also set some short courses to focus on specific topics like pain management or orthopedic conditions or some image diagnosis. So we set some short courses, and last year we made the first course, basic course of Chinese herbs.
Okay.
This is the first time that our association made. So
yeah. You're already making the first steps towards Chinese herbs being regulated.
Because I believe TCM is not only acupuncture.
No,
we have to expand all the treatments. So I was elected last year. So I represent a new generation to lead our association, and this is an opportunity to open our mind and to show to our members that we can offer a better condition like Chinese herbs to our patients. I think this is a big chance to improve and to get more information, more knowledge about TCM, and also to break all the, how can I say, preconceito about the TCM theories like yin yang and 5 movements. We can work in this kind of information.
Yeah, well, that's great about having progressive minds like you in order to progress associations, you know, thinking of the future and reaching out to all, for instance, modern technology and social media.
Thank you very much. It's a very big challenge when you take some news to our society. Of course, more traditional minds can do not like the chance, this kind of opportunities.
Yeah, but also I think there are a lot of people who want to take TCM in the next step, the next level into the future, but also traditional minds, but they just don't know, you know, by what means. And the modern society is going really fast and everything's changing. So it's good to have people that are up to date with modern technology and how to bring, and also have a clear vision for the future of things and planning, but also know how to bring TCM into the next level and integrate it with global medicine.
Yes. I think all this technology is helping us to spread all the information about TCM, not only in Brazil, but all the world. So I can see from our patients, from Brazilian people, they also are very open to receive this kind of treatment. So here we do not, I don't like the alternative treatment term. This is not good. Maybe the better term is complementary or integrative treatment, right? Because if you say alternative treatment, I have one way, I am choosing another way, but this is not the goal. The goal is to take all the possibilities, right? So I think this is my impression, my feeling about the Brazilian people. They are more open to receive, to accept this kind of treatment and to combine. So I can, if you compare now and 50 years ago, they changed the idea and the concept of all this kind of treatment. So I, in my opinion, this is a very good improvement we had here in Brazil.
Yeah, I fully agree about your idea about integration, integrative medicine instead of complementary medicine. And that's why, through my channels, I'm also working on an image rebranding of TCM. And with all the associations that I'm also affiliated, I'm trying to rebrand the image of TCM because people need to know TCM medicine is for the world, right? And so the world needs to know what medicine can do, also this branch of medicine. So it is important that the general public gets to know more about TCM, that it becomes common. Like you see a TV series, I don't know, Chicago MD, or what are all these hospital series called? But there's no series about a TCM hospital, right?
Yeah.
The only one I recently saw on Netflix is about it's a Korean series. Have you seen it?
Korean, yeah, right.
Yeah. So, and that was really great. I really loved that series, and also because it took TCM seriously. There were actual points, actual theory. It's not fake, and they were on the same level. So we need more of that. We need more of that. And then, of course, what's important for integration is education, by regulating everything through education and laws to get better integration of the medicine.
Yeah, totally agree. Totally agree. So I think we will make this progress. I hope that we can make better doctors, TCM doctors or Western doctors, with all the views of the about the patients. So I hope this we can make this as soon as possible.
I share the same hope with you. And so, yeah, well, I think that's a great conclusion to this interview. I'd like to thank you for your time.
This is my pleasure. Thank you.
And hopefully we'll see you again for another interview at the TCM community. Okay.
Maybe here in Brazil next time.
I hope so. I hope so. If you can travel safely again, I'll come to Brazil. I'll visit you in Sao Paulo.
Okay. Okay.
Okay.
Thank you very much, Topi.
Thank you. See you next time. Bye.
See you. See you. Bye-bye.